This is how many people in the United States have not been able to afford healthcare from 2010 to 2023. Although the number is decreasing, the amount of people that still cannot afford healthcare is astronomical. My name is Jade Mazer, and I think that regardless of income, all Americans should be guaranteed basic medical care under a national health insurance program. And here's why. Many Americans die in the United States from not being able to afford healthcare. According to the Harvard Gazette, it is estimated that lack of health insurance causes 44,789 excess deaths annually. This statistic should be enough for the United States to create universal health care for citizens of the United States. According to Public Citizen, the Institute of Medicine found that the uninsured were 25% more likely to die than those with insurance. The study says that the real number is closer to 40%. Americans should not live their lives fearing death because they cannot afford health insurance. There is a need for fix because not all Americans have enough money no matter how hard they work. America's healthcare system favors people with money, leaving millions of people without medical treatment. This is not okay. According to Kaiser Family Foundation, adults in households with annual incomes under 40K are more than 3 times as likely as adults in households with incomes over 90K to say it is difficult to afford their healthcare costs. No one should have to say that it is difficult to have their basic needs met. Furthermore, according to the Commonwealth Fund, an estimated 26 million Americans, or 8% of the U.S. population, lacked health insurance in 2023. Health insurance should not be a right for people with money, but instead a basic human right. If you are not on my side, I would like to take a moment to go over some common opposing views. Some opposing views could be that you need to work for health insurance. My argument is that many people work very hard and still do not have enough money for health insurance. Secondly, an opposing view could be that it would be too expensive and tax would increase. My argument is that tax may go up, but the overall cost of healthcare would decrease. Lastly, an opposing view could be that it would lower the quality of care. Well, my argument is that many countries with universal health care maintain high quality care, which leads me into my next slide. Many developed nations have successfully implemented universal health care, so we should too. Most countries worldwide have some sort of universal insurance coverage. According to wisevoter.com, there are 72 countries with universal health care. According to the World Health Organization, the delivery of these services requires health and care workers with an optimal skills mix at all levels of the health system with access to quality assured products. This means that universal healthcare is safe and reputable. Universal healthcare in other countries is proof that it can work in the United States. A solution could be that the United States provides universal healthcare while educating citizens on the requirements and benefits of it. The government also needs to ensure citizens of quality care before acting on it. Universal health insurance will health improve citizens' health by providing early detection and treatments to prevent illness. Universal healthcare is fundamental for pandemics and can help stop the spread of them. Do you want to go through another pandemic like COVID? Because I know I don't. According to Britannica, we determined that such a system could save 211,897 lives in 2020 alone. To continue, according to National Library of Medicine, universal health care protects health by ensuring all diseases are continuously monitored and by developing appropriate interventions for the timely prevention and control of those that pose a threat to people's health. Not having universal health care influences people not to go to the doctor or get checked out if they have worrying symptoms because they will not be able to afford it. The benefits of my solution are that people will be treated for things without having to worry about money. Pandemics will be much less likely to happen. People will not be in insurance debt, and citizens will not fear their health because they do not have enough money for insurance. Guaranteed health care is not only a smart policy, but a crucial step toward a happier society. According to World Bank, with good health, children can attend school and eventually reach their full potential, while adults are able to lead productive, healthy lives. These things make the world a happy and healthier place to live in. According to the World Health Organization, it enables universal integrated access to health services as close as possible to people's environments. It also helps deliver the full range of quality services and products that people need for health and well-being, thereby improving coverage and financial protection. Universal health care will make the U.S. a better place to live in. This is not a privilege, but a right. Now that you are informed on the benefits of having a universal healthcare system, you are probably wondering, what can I do to make this happen? Well, first off, you can tell your friends and family the benefits of having a universal healthcare system implemented in the United States. You can show them this presentation. Really think about the impact a universal healthcare system can have on a society. But most importantly, according to WebMD, it is important that you take action in staying informed and doing your own research. Keep learning and educating yourselves on universal healthcare.